Thank you very much, Kristin. Any other panelists wishing to weigh in on this one? Okay.
I just have one comment. Another thought is if you notice that either a student or an employee, because we are talking about employees, and thank you, Alexis, for mentioning that. This is not only about students, but if they're using more substances, or if you notice that they are either using substances at work or school, or that you just notice that they're using more over time. And I think there's often some fear about how to handle this if you do see it, but oftentimes it's just making that observation. If you know the student or you know the staff person, I notice that something's different now. I notice that you're dressing differently, or you don't seem to be quite as engaged. That's usually, a good way. You're not as engaged as you once were. What's going on? It can be that simple.
Thanks. I want to drill down a little deeper in what you were just referencing, Joyce, and that is, as if we are committed to reaching out to support, help those with whom we live in a campus community, specifically the kind of support that we offer to colleagues as opposed to students. How are those approaches different? And the sidelight question to this that was submitted was, how do we be present and supportive for students while also encouraging them to continue with their work, et cetera, as that is important for their long-term interests? So two-part question again. One is, what are the differences in terms of dealing with colleagues who we see as struggling, or we understand to be struggling, versus students? And then also, how do we support those students in continuing their coursework? And I would say perhaps the parallel with those of us in professional staff and faculty is to ensure that they take advantage of resources while at the same time continue their professional development as a faculty member and as a professional. So multi-part question there for all of you to consider. Who wants to go first? Okay, Kristin, go ahead.
So as far as how you're going to talk to a student versus how you're going to talk to a colleague, it's very much the same. It's about treating people as humans and just meeting them where they're at. I think we all very much appreciate when people notice us and when people reach out to us in a caring way. I don't think it should look different necessarily for a student versus a staff member. There should be, the personal reaching out to people and having those one-on-one conversations. That's one of the things that, unfortunately, part of this mental health crisis is because people have become so distant from each other, and we do so much through technology rather than face-to-face, that human contact. So as much as we can do that, that's going to be your best strategy. I know at Binghamton, we're very fortunate that they have so many services available for students, and we're able to, after talking to a student, we can fill out, a form for the care team to check up on them and be sure things are going on that need to happen for them. It's obviously not that simple when you're talking with faculty. And so, being more open to talking about that EAP is available, that there are services in the community that are available if you're not comfortable going through the EAP, but that there are things available that are specific for staff, and just making it normal to use those, because the EAP is also much more than just getting some counseling when you need it. There's so many subjects that you can get help with through EAP, and if we can normalize that, that's going to help faculty members feel more comfortable when somebody else brings that up.
Great. Thanks, Kristin. Any others wishing to weigh in on this?
I just wanted to mention, Fred, that, and I'm glad you mentioned the Employee Assistance Program, Kristin, because I think it is valuable on campus. The other thing that is true at the University at Albany, and I'm sure at many other universities and colleges represented here, is a liaison relationship. So, for example, all of our clinicians who are in CAPS, counseling and psychological services, well, not all, but they have liaison relationships with offices and units on the academic side of the house, as well as others who might serve students. And so a faculty or staff member who might be concerned about a student can pick up the phone, call and speak to one of the clinicians about their concern about a student. Now, that service is not available for faculty and staff for themselves, but it is for faculty and staff who are concerned about a student. So if you're not quite sure how to approach a student, you have resources on campus to help you with taking those additional steps. And what we are doing on campus is making sure that we break down the silos, because given that the approach can be similar, we are involved in some programming together that supports students as well as employees. And that could be around mental health awareness days, for example. So the EAP individuals and the CAPS professionals can collaborate, for example, around those issues.
Thanks very much, Joyce. Okay. I'm going to, once again, it was some, I think both of you alluded to, I know Kristin, you alluded to this in terms of the remote workplace and so forth. We got a question that was pretty specific, and that had to do with students who are distance learners and may not even be in New York State. So what sort of campus support or methods would you all recommend in dealing with students, and for that matter, employees? We have members of UUP who never set foot in New York State. They're elsewhere in the country, teaching distant, teaching remote, teaching in a nursing program at Delhi, for instance, Sean. So what would you see as ways to be supportive in those circumstances, while also, I would add to that, for those of us who spend so much time in settings like this, that would be me, what kind of, best practices, self-care is recommended for those of us who deal with distance workplace environments far too often in our day-to-day lives? So it's both in assisting students, but then also colleagues and ourselves in this kind of distance setting, all the way from California, Lauren. So anyone who wants to jump in on that, please do so.
So it's really, I'm going to go back to that personal contact. So I know that if people are distant, that we can't be in a room together, but face-to-face communication really does make a difference. So rather than just emailing or texting, having check-ins where you're actually looking people in the eye and really kind of seeing how they are. And I think if you're doing, if people are fully remote, I think it's important to have times that are social, that are happening virtually. So people have lunch together, or, people can, have a trivia game night or something, some way of being able to interact in a human way, rather than just as the teachers or the learners, or but being able to be human with one another is super important. I see clients who are working from home and they're really getting into deep depressions because they're not having interaction with human beings anymore. And so we need to come up with ways to do that and be creative with that, and normalize that we're going to incorporate some fun into what we're doing. And and turn on your video so that we can see you, because it is important to see people. We're meant to live in community, not to be isolated.
Great. Thank you, Kristin. Sean, go ahead.
Yeah, to jump in, I think just in general, it's never bad to ask the question how someone's doing if you've noticed anything's off. I think with people who are remote, whether they're students or peers, have a way, ahead of time, if you're worried about someone, to maybe talk with them and work to find someone in their area, wherever that may be, a professional or a hotline or whatever resources might be in that person's locality, so that when you do talk to them, if they do start opening up, you have that contact, that method ready. And maybe it's even something that you can do with them, even if it is over Zoom. As far as students who are abroad, which I think was a version of the question earlier, that might be a little bit more challenging depending on where they are. But even just face-to-face online can make a big difference. I've had meetings with students where they have their phone with them, and I ask them what's up. They're like, "Oh no, I'm just in class." And I'm scheduling to talk to them for a conduct meeting, and they just have the video off, sound off, checked out. So being able to see someone is really important, or at least making sure that they are engaging in some way is key.
Oops, thanks. Yeah, John, go ahead.
Yeah, just piggybacking on what Sean said, in terms of identifying local supports, and some of the strategies you might use to do that would include contacting a mental health association affiliate, a national alliance on mental illness affiliate. They're usually in most counties in most regions of the country, for local resources. Many county mental health departments, many have single points of access type of setups where you can get resources through them. So yeah, just seeing if you can't build some options for them. Always remind them of 988. That's in effect now, that people can be using. They have that in their back pocket. Talk to them about, if you feel like you're in crisis, try to support that move. Like call 988. If you're in crisis, call me. Call 988. We'll call them together. All those kinds of things. But having some strategies, Sean's right, so that people have a sense of where to go. Go to your primary doc if you can't find anybody else. Go somewhere. Talk to someone. Get out of the house. See a person face to face. Join a group.
Very good. Thank you, John. I wanted to pivot from that to, I got two different directions I want to go in. They're totally different. But one is, alluded to in passing a number of times, is something that we heard from in a variety of different ways, and that is the shortage of mental health care professionals, all the different forms that professions that those can be in. We've got members quoting people who are at Upstate Medical University, upstate patients and staff who can't find adult and pediatric mental health services due to a lack of providers. They stipulated taking our insurance. In fact, what it is just a lack of providers. Those who are mental health care providers and are seeking a therapist for themselves, but are having a difficulty finding a therapist that is not a colleague where they work. So I want to challenge the panel. We do have a national healthcare crisis. We have crises. One is a growing shortage in all fields of healthcare, but I have a concern that the emphasis is so much on, not that these aren't crises, on the lack of nurses, on the lack of primary care physicians, on techs, on all the different healthcare professionals. But what oftentimes is not accentuated is the shortage of mental health care professionals. It's why UUP is advocating for, we've done it in a variety of different ways with the Educational Opportunity Program, to have a mental health EOP, to create a pathway program to bring diverse individuals into these professions from the earliest of ages. So that I'm afraid I'm going to go off on a rant here. So I'm just going to stop there and ask you all for ideas, whether they are policy oriented or not. It doesn't matter. I personally want ideas, and I think that that all of us, I think, comprehend the depth of the crisis we're facing. That is exacerbating all the other crises in the mental and emotional health areas. Whoever wants to dive in first, please go ahead.
I think it's twofold. I agree. We need to have more pathways for diverse populations and individuals to have a way into these career fields. My own experience was, I'm a licensed psychologist, but I remember when I was in high school, I told my guidance counselor that I wanted to become a psychologist, and she said, "No, you really don't want to become a psychologist." And that was because she didn't have that experience herself. So she was trying to steer me in another direction, which wasn't at all what I was interested in. And it was difficult because when I looked around at the University of North Carolina, Chapel Hill, where I went to school, I didn't know any psychologists. I didn't have a frame of reference for what that meant. And so I think someone put something in the chat about mental health literacy. And I think starting in K through 12 and making sure that people understand what this is as a career field. And this is a part of the healthcare system, right? Because we think of mental health as very different than health. And so we know that if we have diabetes, or if we have some other health problem, we go to see a doctor and we get the medication and the treatment that we need. And we need to have that same frame of reference in K through 12 around mental health. And I don't think we have. But I also think this is twofold. So I agree with you that we need something like pathways, but I think we also need to get it, and that's outcome, but I think we also need to think about what happens at the other end. I think about the root causes for mental health problems, and that is related to all the isms, ableism, racism, heterosexism, all of those things impact our mental health. And we need to think about things, think a little bit more broadly. And I think we also need to get at, as Lauren mentioned earlier, and I think the senator did too, the systems and structures that are in place that impact our mental health. And some of the systems and structures that are in place in higher ed support, and there are some that don't support our mental health. And when I say our mental health, I'm talking about students as well as faculty and staff. So we really need to think about, it needs to be a two-pronged approach, I think, thinking about upstream and midstream and downstream approaches to getting at this issue.
Very good. Thank you. And thank you for raising the causes of the crises as crucial for us to comprehend and center on as well. Thank you. Lauren, go ahead.
Yeah, once again, I agree with everyone's comments here. And maybe this is more on the like what to do in terms of like bill legislation or other things, but pipeline programs were mentioned. I think it's really unclear to many, teenagers and also at the higher ed level, what they do, right? Like, I want to be a therapist. What does that mean? Does that, like if I graduate with a bachelor's in psychology, what are the opportunities available to me? What if I graduate with a master's, how many different licensures do I have to? There's so much professionalization that's important, but I think there can be a lot of clarity on, here's clearly what the state of New York is saying. If you have an AA in this, here are your pathways, and I think the state can really incentivize careers in the field, whether you are coming out of high school and interested in being a peer support specialist, or you are coming out of a 2-year degree and want to do something. There are in a workforce shortage, we have so many open seats and people who don't know how to get to them, and I think that's a really important piece. And I can talk about this a little later, but I did also want to mention that New York State has made a lot of progress in in some of its parity legislation and in its budget bill in 2019, 2020, they required updated provider directories so that you can see if providers are accepting new patients. There's a consumer guide that comes out every year that's meant to help people get resources on that. So that maybe was more related to a previous question, but I wanted to make sure that folks knew about that. So I'll drop the link to that consumer guide for folks, but I really think there's, a lot of open pathways that folks don't know about. And while you're trying to figure those things out, and looking for your own provider and your own, taking care of your own mental health, I think it's important it's a 1-2.
That's great. Thanks a lot, Lauren. I think, Kristin, you were next, but I don't remember now. But no, John? Okay, John, go ahead. Thanks.
Oh, yeah, just kind of what Joyce and Lauren have both been talking about. Workforce, it's our biggest priority at Mahaney's now. Because of all of the shortages, we're trying to look at some creative ways of sort of filling in, as others have said, that pipeline between, whether it's high school, associate, bachelor's level, and in licensed professionals. I read a statistic somewhere where only 34% of psych and soc majors go on to an advanced degree in mental health. So a lot of them, there's nothing in between really for them. So thinking about what kind of pathways there might be, OMH came out in last year's budget with a recommendation for something called a qualified mental health associate, that someone would be able to access, similar to, say, a KSAC-T or another type of a pipeline type, career ladder type of position. And there are some challenges associated with it. There's a lot that those people can be doing in a new title like that. Unfortunately, OMH rolled it out in a way that it was somewhat ambiguous, and it made some licensed professionals a little bit nervous around scope of practice issues. But if we can delineate more clearly what those tasks are that these folks could be doing that do not infringe upon scope of practice, there's a lot of things that people could be doing. One that I think of oftentimes is what happens to people when they're waiting for help, when they maybe have secured help and it's not coming for 3 weeks or 6 weeks. What's happening in that interim time? Who's checking in on them? I think we should go to the licensed professionals and we should ask them what would be helpful. What can we take off your plate? And create some titles and some pathways. And they can be an end in themselves, or they could be a career ladder to a licensed profession. But we got to start getting more creative about how we're doing the overwhelming task of meeting people's mental health needs. And we clearly don't have enough professionals to do it.
That's great. Thanks a lot, John. Now, Kristin, go ahead.
Yes. So I just wanted to say that in the social work profession, there have been some changes. Last April, New York State changed the rules about licensing. So there's no longer the requirement to get to the R number in order to be able to bill like Medicare and those kinds of insurances. And so it's taking less time now for people to be able to get to that clinical level and billing all of the insurances. There's, of course, some major flaws in our system with insurance, which makes it very challenging for individuals that are trying to go out into private practice to be able to get credentialed and navigate that whole system while they're trying to provide services to so many people who need help. So unfortunately, that does make it all very complicated. But also, there in social work, bachelor's in social work can take a year off of the master's program. So you're basically starting your master's as a bachelor's student and then able to go for your master's and then get out into the world doing the things you want to do. So like Lauren was saying, we really need to be letting people know what their options are, because yes, if you want to go through PhD processes and all of that, that's going to take a long time to get out there into the field. But taking this other route can be a faster way and get more people out into the field, which can be super helpful. And so I do also want to touch on, I know people were concerned about, how do we help, faculty and staff who need help and supports and what's available. I honestly, when I ended up on this panel, but I had started out just trying to figure out how can I get information out to everyone, because that's one of whole wellness counseling's goals, is to help people who are dealing with, secondary trauma. So those helpers out there who are going through things because they're supporting other people. And so we're hoping to be able to help the professionals who are struggling with being able to help other people. So that is something that we're trying to accomplish.
Well, that's excellent. Thank you very much, Kristin. Sean, go ahead.
Yeah, just real briefly, the getting people interested in the field at an early age is important and can help long term. A little bit of self advocacy, though. There's also older people like myself who it can be a challenge to be a full-time professional and a part-time student. And if there's ways to design education programs to get people into the field that will work for busy people, maybe they have a family and commitments for childcare or a really heavy workload. We live in a day and age when people change careers. And if there are things that we can do to make it easier for someone who is looking to do a career change like myself, I think that could open some doors as well. And that might even be something we can do within our own system. So just a thought.
That's very good. Thanks, Sean. As is always the case, the time has flown and we've come to the hour mark, but I do want to ask one more question. I can do that because I'm the president of the union. No, I want to ask one more question. And it's at root, it is a very basic question, but I'm going to make it a little bit more complex. We had our recent delegate assembly, and during the course of the assembly, I made a brief comment to the assembled delegates who would be going back to campuses that we represent, 29 campuses plus system administration. Basically giving them a heads up as they interacted with people, not just in student life and student support, counseling and healthcare, but also as faculty members and as members of the community, that we are fully aware that there are these are troubling times, and we have members of our campus community who have deep connections, sometimes family, sometimes based on religion, to different various sectors of the Middle East. And as tensions and violence continues to escalate, the stress on our international students, but also on students who are here with connections there. I just wanted to give a heads up to our members that as they returned, they would be dealing with colleagues, with students who are troubled, angry, mourning, all of those and more. And so the question is partly that, how do you recommend, for all of us to deal with the continuous rising of violence in its many forms, globally and locally? And at the same time, how do we, and the same question, I guess, how do we maintain self-care, or how do you recommend that we do so, given your lives and you live in the same world that we do? So how do we deal with this? How do we deal with those with whom we interact, who are connected to these horrible situations and therefore need our help, and as we need help as well? So it's about self-care in these troubling times, but also reaching out to those who are going to be particularly challenged. Sean, you can lead us off. Go ahead.
As far as what's going on globally, it is challenging. I don't know a whole lot about what to say for that. I'm pretty sure that one of our faculty members here at Delhi lives in Israel, and I'm sure that we probably have other members who live there and are there. And it's very troubling, and I don't have much more right now that I can comment on that. But for self-care, one of the things that I've been thinking about for this question is to use whatever time you may have to, take a day off or take a couple days off. It's a point of pride for many of us in our culture to never miss a day of work. We give awards to children for perfect attendance, and that's not always healthy. I think if you have a bank of time built up and you need to take a day, you need to take longer than that, then take it. If you don't have a whole lot of time, find some way to talk to your supervisor or something, but just try to use that and step away. It's simple. It's not a complete solution, but it can help.
It's very good. Thank you, Sean. Kristin.
So in my classes this week, I have been running circles to just give students an opportunity to talk about the stressors that they're experiencing and how they're coping with those things, and just giving them some validation in what they're trying to do in order to protect themselves and help themselves with everything that's going on, whether it's local things or things around the world, and really just listening, and that's what we really have to do for one another is be there for each other. We really need to be offering supports as much as possible, through I don't mean to be bringing up the name again, but Whole Wellness Counseling is offering support to folks who are touched by what's happening in Israel right now. And so, giving away 1 or 2 sessions to offer that support, because it is really hard stuff, and people shouldn't have to feel alone in trying to deal with those things. So I think we all as a community need to find, who do we work for? What do we do? How can we be part of the solution in supporting one another? We can't bring peace to the world necessarily, but we can certainly bring it to our neighbors and those who are close to us.
It's very good. Thank you, Kristin. Joyce.
Yeah, thanks, Kristin. I wanted to just say that we should check in with each other. Yes, we can connect around the fact that we're humans, and this is difficult. This is really hard, but check in with your colleagues, check in with your students. If you're a faculty member, just let people know that you're there for them. And whether you have family or friends who are directly involved in this, or colleagues who are abroad, we're all impacted by it. The other thing is, I tell folks to limit their screen time. So you can watch any news outlet 24/7, and that's mind-blowing in and of itself. And so put some limits there, maybe 15 or 20 minutes of screen time, or if that's too activating, which it can be, because then you get images and all of that, which is traumatizing to us too, vicariously, print media for 5-10 minutes a day is much less activating, and you still have the information. And for folks to remember, this is all very polarizing. But I remind students and even my colleagues that even when you're on social media, right, there are algorithms in place. And so that creates confirmatory bias. And so you get more of what it is, whatever your viewpoint is. And so then it becomes this very interesting bubble that we live in. And so to just listen to people and, check in with folks, and limits and boundaries, I think are really good things to consider. And to know that we need to think critically about everything.
Yeah, we do. Yeah. Lauren.
Yeah, I agree with everyone's statements on this too, but I think I actually said this one of the last webinars that I was on, but just the importance of remembering the things that bring you joy. When you are all in really important, demanding jobs that are really valuable for many people, but thinking about what's valuable for you and taking the time for yourselves and I am so guilty of not doing that. And I think it's just worth like taking a step back to do the things that you enjoy, even if it's like, I'm going to go to the farmer's market this morning and like get a thing of flowers, or I'm going to like spend extra time, playing with my kid in the backyard or whatever it is. I think those things are, I mean, they've always been important, but more important than ever. And it's not everything has to be on our shoulders. So I'm not trying to preach, but I'm preaching to myself a little bit too. And I think that, and I'm just very thankful for all the work of the people that are on this call and everything that you do. And I really hope that you take that time for yourself too.
Thanks very much. It is not easy in this day and age for us to find the time that we need to be healthy, and to be therefore stronger for those who need our strength, whether it's family, whether it's community, whether it's the world at large. Those of us in education, in healthcare, student services in general, and that's our union, that's our community. We are facing such difficult and challenging days, and yet I remind everyone that ultimately in our professions, in the work that we do, at the end, what we are seeking is truth, and wisdom, to guide us and to guide our communities. Very old concept. And it does mean at times that we have to challenge ourselves. It is not easy for one who has connections to a whole bunch of different places in the world, to see how the news and even our political leaders have framed recent events. The world is an incredibly diverse place. There are many crises where many people are suffering badly, terribly, all over the world, including in the Middle East. There are people in different communities there who are suffering. Certainly, obviously, the Israelis, but also just as obviously Palestinians. And when you look to Africa, to Latin America, to Central America, and goes back to what you were saying earlier, Joyce, in terms of the causes of the mental health crises. You mentioned some. There's also the reality of the environmental global crises we're facing that is leading to climate refugees, and is leading to intense suffering because of the climate crisis. And so with all of this, it is incumbent upon all of us to be present for the truth and to be present for each other. And I just want to say, I'm in awe of our panelists for the work that you do. Thank you so much for this time that you've taken. And just as much, I am in awe of those guests, those who have joined us today, for your questions, for what's been in the chat, for your interest. We will be doing another one of these, but we are also gearing up for the legislative session. And I'm looking forward to talking with you, John. You had mentioned it, Lauren, and actually all of you, as we start talking about legislative pathways with Senator Brouk and others, and because it's a necessity and it's urgently needed. So with that, I want to thank all of you for your work and your presence in the SUNY community and in the community at large in trying to make our world a more humane place. So thanks again, and take care of yourselves, folks. And we'll see you again soon.
Thanks, Fred.
Take care.
Thank you.